I released a video recently about continuous glucose monitoring, and for many of you, maybe even more important, needle-free glucometry. Getting a blood glucose level, continuous numbers, 8-hour period, or even an 8-hour period, without a stick. I didn't tell you that something similar has been available for a couple of years here in the U.S. It's called the Abbott Freestyle Libre Pro. Now, here's what the Pro is. A lot of docs have been interested in it because it still gives us that continuous glucose monitoring curve and the variation in the curve. But a lot of patients are not nearly so interested in it, and you don't get the raves on it like you do in the Libre that's been used for 2 years in Europe. So here's why. It's only available through docs. It's blinded to real time. So what that means is you get the reading and you still can't see it. So as a patient, you're totally dependent on getting back to your doc, downloading and showing that information to him or her, and then getting the interpretation from the doc. You don't get to correlate it with what you did today unless you keep really good records, and how you feel today unless you keep really good records. So that's the problem with it. Again, you have seen some uptake on it. For those of you who don't remember what I'm talking about with the Freestyle Libre, here it is. Even ABC News, a lot of the big non-medical news folks picked this up a couple of weeks ago. It was recently approved by the FDA. Again, it's been available to Europeans for 2 years now. Again, they've been raving about it. So you haven't had easy access in the U.S., but as you can see from this, a lot of people have been getting it in the U.S. The way they've been getting it is finding someone in Europe to buy it for them and ship it to them. Now, what is it? Well, it's a little round patch that you patch to your upper arm or belly usually. You first attach it. It's got a filament in it. That filament stays underneath the skin and measures glucose values, blood glucose values. Instead of having to do a stick, you just wave this sensor over this patch. When you do, it downloads continuous glucose numbers over the past 8 hours. Again, what you do with the Pro version that you can only use with the doc, you do it for 10 days or 2 weeks. You take it into the doc downloads it, and then he or she interprets it for you. You already know that information. Let's just review real quick the kind of information you get from this. Instead of getting one data point, you get the whole curve for 8 hours. And instead of just the curve for the past 8 hours, you can get a full standard deviation of the variation that you've been getting during those time periods, and another standard deviation. So you get a great clarity regarding your blood glucose metabolism patterns. The fact that we've had that information, that technology has been available for the past 2 years, and the people in Europe have been using it for 2 years, getting great results, great help on caring for their diabetes, and we've not been given access to it by our friends at the FDA is, guess what, a little bit irritating. Well, a little more than irritating to me. I'm very frustrated about it. But you could get the Pro version now through your doctor, or like many of us, you could continue to wait. The retail version It's supposed to be out sometime over the before January 1. Thank you for your attention.